Uh-oh.
This is how you use a tilt table. You use 3 to 4 straps. One goes on the shins, one goes above the knee. You don't want it directly on the knee, just in case if they bend a little bit, you want them to. One over the stomach. And you can have one over the chest. Make sure none of the Velcro straps are attached to the tilt table. And we want to make sure that she has strong enough blood pressure to be able to handle this. It should be above 65 over 40. And we don't want her to feel nauseous, to sweat, to have any decreased temperature, or to have any else like that. What we're going to do is we're going to bring her up. If it's her first treatment, we're going to bring her up just 10-degree increments, and we want to check her pulse and or her blood pressure at those times just to make sure she is stable enough. What the tilt table does is that if a person is been in bed with, say, a coma or has decreased endurance, this will help gradually put weight bearing into their legs, get them used to being in an upright position. So now I'm going to bring her up 10-degree increments. How are you feeling? Okay, we're at so we brought her up 10 degrees, and then we'd assess her pulse, make sure that she's feeling fine? Do you feel nauseous?
No.
Are you comfortable?
Yeah.
Okay. Straps too tight. I'm going to raise you up another 10 degrees. What the uses are for the tilt table is to repair a patient to resume the upright position and to help prevent osteoporosis in the lower limbs. It also helps to prevent the formation of urinary caliculi and genital urinary infection, and it helps to prevent it helps to improve circulation, nutrition, and morale. We're going to go up another 10 degrees. And we would keep checking her pulse, her blood pressure, her temperature, make sure she's not nauseous or dizzy. If she is, bring her back down a few degrees to normalize her. And then that's where she should stay for a couple treatments, and then gradually increase the degrees if she feels better. Now we're going to go up another 10 degrees. How are you feeling?
Fine.
Another 10. The end goal is to get to 40 to 50 degrees, and right now we're at 50 degrees, and that means they can tolerate sitting in a chair. And then you want to progress to 60 to 65 degrees, and then that will get them to the point where they will be able to stand and tolerate it. 60 degrees. If a person is healthy before they're either in a coma or surgery or anything like that where they would be bedbound for a certain amount of time, the tilt table will help them get to more normal living. If they were healthier prior to it, it'll get them back to normal faster. But if there was decreased endurance, heart problems, anything like that, the tilt table will have to be used in moderation and gradually increase. It'll take longer than a healthy person. And we'll go up the rest of the way. And it's pretty much in a standing position to get them weight bearing. It'll increase their circulation. And you continually check blood pressure, pulse, and temperature. Make sure she's not nauseous or dizzy. How are you feeling?
Good.
Okay.
How long?
Usually stay at every degree with 5 to 10 increments at every degree to make sure they can accommodate and feel normal being in the standing frame. And then you can increase by 5 to 10 degrees in weight every 5 to 10 minutes to make sure that they're fine. Then when you go back down, we'll go down in 10-degree increments. Check the same vital signs as well, make sure she's not dizzy. And we'll bring her the rest of the way down. How you feeling? Fine.
Alright.
Now way down at the bottom. And then just take the Velcro straps off. If she tolerated it really well, we can continue the treatment. And that's how you use the tilt table. Also, let the person rest for about 5 to 10 minutes just to make sure that they get back to normal feeling, make sure they're not dizzy or nauseous, check their vital signs, and then they'll be able to get off the tilt table. That's how you use it.